Let's dive right into a fascinating and frankly terrifying medical mystery. We're talking about a completely mundane lunch that unexpectedly led to a full-blown cardiac arrest. Welcome to this explainer, where we're going to unpack the unbelievable chemical chain reaction that can turn a simple kitchen mistake into an absolute life-or-death crisis.
So how exactly did a simple leftover vegetable dish stop a man's heart? Well, we're looking at a case investigated by the CDC. It started when a 45-year-old man named XD ate what looked like a succulent, perfectly normal vegetable dish cooked by his daughter, Ivy. It was supposed to be just a regular afternoon, but instead, his organs rapidly started shutting down just minutes after he finished eating. How does a basic plate of veggies literally suffocate a person from the inside out?
Section 1. The deadly leftovers. A family dinner turned crisis.
To figure out how this happened, we have to trace the events back to a big celebrative family gathering. On day one, Ivy cooked this massive feast. There were so many options on the table that one specific vegetable dish was left completely untouched, and it just sat there harmlessly in the fridge for 3 whole days before XD finally packed it for lunch. When he ate it on day 4, his body's oxygen levels catastrophically plummeted. And the really scary part, shortly after that, his son June ate from the exact same batch of leftovers and suffered the exact same terrifying fate.
By the time XD arrived at the hospital ER, his body was crashing hard. The doctors noted he had severe tachycardia, meaning his heart was just racing uncontrollably out of his chest, along with incredibly low blood pressure. But the most alarming part? He was suffering from severe hypoxia. His oxygen levels were absolutely plummeting. Even when the medical team strapped an oxygen mask to his face, the numbers just kept dropping. His skin turned a pale gray, he was cold to the touch, and eventually, his heart completely stopped in a pulseless electrical activity cardiac arrest.
Section 2. Chocolate-colored blood. A bizarre clue.
While the doctors were frantically performing CPR, trying desperately to save XD's brain from permanent oxygen starvation, a standard blood draw revealed a totally shocking anomaly. The blood was an abnormal chocolate color. It wasn't red like it's supposed to be. That dark brown color was a massive red flag. It instantly told the medical team that XT's red blood cells were fundamentally broken. They weren't just failing to deliver oxygen anymore, they were actively choking his organs.
Section 3. Rusting from the inside. The biology of suffocation.
To crack this case and figure out what was up with that chocolate blood, we really have to zoom in on the microscopic chemistry of why our blood is red in the first place. And it all comes down to one absolutely crucial metal: iron. Our healthy, vibrant red blood relies on iron in a very specific state called iron 2, which is missing exactly 2 electrons. That specific setup creates the perfect little empty pocket for oxygen to bind to and catch a ride through our veins. But if that iron loses just 1 more electron and becomes iron 3, its entire shape changes. It becomes completely useless for respiration. It literally cannot hold on to oxygen anymore. And visually, that's what turns the blood a dark, chocolate brown.
Think of it kind of like a piece of metal left out in the rain. Just as oxygen and water strip electrons from metal to create rust on a car, something inside XD's body was aggressively stripping electrons from the iron in his blood. His hemoglobin was being forcefully oxidized into what's called methemoglobin. He was essentially rusting from the inside out, triggering a severe, life-threatening condition called methemoglobinemia.
Section 4. A case of mistaken identity. The CDC investigation.
Knowing exactly how the blood was damaged gave the CDC the clue they needed. It led them straight to XD's workplace desk and Ivy's kitchen to figure out what sparked this violent chemical reaction. And here's what they found. A few weeks prior, while helping clean a friend's house, Ivy came across an unmarked plastic bag filled with white crystals. It looked exactly like sugar. So, understandably, she assumed it was sugar, brought it home, and later used it to season that leftover vegetable dish. But it wasn't sugar at all. It was actually a lethal, highly concentrated dose of sodium nitrite, a chemical that's normally used in tiny amounts as a preservative for cured meats and sausages.
The moment XD and June digested that dish, the nitrite kicked off a runaway chemical loop. First, the nitrite forces the oxygen already in the body to take on an extra electron, creating superoxide. The body totally panics and tries to neutralize this by turning it into hydrogen peroxide. But then, that hydrogen peroxide relentlessly attacks the bloodstream, stealing an electron from the healthy iron 2 and turning it into that useless iron 3. And this destructive cycle just kept happening over and over, stripping electrons from XD's hemoglobin way faster than his body's natural defenses could possibly repair it.
Section 5. The blue antidote. Reversing the rust.
With their patient's blood rapidly rusting away and their organs completely shutting down, the doctors needed a chemical circuit breaker, and they needed it right now. The very second the medical team spotted that chocolate-colored blood, they injected a chemical called methylene blue directly into XD and June. Now, methylene blue acts like a rapid-fire molecular delivery service. It goes in, grabs free electrons that are generated from the body's natural sugar breakdown pathway, specifically from a chemical called NADPH, and physically carries those rescued electrons right back to the damaged iron 3. It hands the electron over, instantly reverting the iron back to healthy iron 2. By aggressively repeating this cycle, it completely restored the oxygen flow in their bodies.
Section 6. The dose makes the poison. A vital warning.
Fortunately, both XD and June made full recoveries, all thanks to that rapid identification and the methylene blue antidote. But this incredible case leaves us with some critical, modern safety takeaways. First, let's talk food safety. Because unmarked white crystalline chemicals are so incredibly dangerous when they get mixed up with common ingredients, regulatory authorities in the US now legally require food-grade sodium nitrite to be dyed bright colors, most commonly pink. It's a deliberate, simple visual cue designed to make absolutely sure no home cook ever mistakes a potent preservative for everyday table salt or baking sugar ever again.
On the flip side of this story, we have to impartially report on a really concerning trend that's sweeping the wellness space right now. Believe it or not, social media influencers are currently promoting the daily consumption of methylene blue. Yes, the exact same hospital antidote we just talked about, as a trendy biohack or cognitive supplement. But casually taking this chemical carries severe risks. It acts as a monoamine oxidase inhibitor, or MAOI. That means if you mix it with common serotonergic antidepressants, it can trigger a fatal reaction known as serotonin syndrome. And, in an act of incredible chemical irony, taking too much methylene blue overwhelms the system and actually causes paradoxical toxicity, meaning overdosing on the cure causes the exact same blood-choking chocolate blood disease it's meant to treat.
All of this brings us right back to one of the most timeless medical quotes out there. The dose makes the poison. It's a foundational rule for both chemistry and medicine. A perfectly calibrated chemical that miraculously saves your life in an emergency room can just as easily destroy your organs if it's casually abused at home for a biological thrill.
Our bodies run on an incredibly delicate balance of microscopic electrochemical reactions. So I'll leave you with this to think about. The next time you see a miracle supplement heavily pushed online, or you come across an unmarked container sitting in a pantry, ask yourself, do you truly understand the electrochemical chain reaction you might be starting? Thanks for joining me on this explainer. Stay safe and always respect the chemistry.